We've seen over 400,000 cases and around 13,000 deaths from this condition. So what is COVID-19? COVID-19 is a particular type of coronavirus which has only really affected human beings in 5 different ways. There's been SARS and MERS and a few very common cold viruses that are also coronaviruses. But this particular coronavirus has led to 20% of people who develop COVID-19 from the coronavirus becoming very ill. And it's around 1 in 5 people who get admitted to hospital. Typically, we're talking about sick elderly people, people with comorbid conditions such as cardiovascular disease, asthma, cigarette smokers. And this is very, very relevant to people living in India because 30% of Caucasians, 50% of Asians, and 100% of people with darker skin carry the gene for insulin resistance, which sets you up for diabetes, high blood pressure, cholesterol issues, fat around the belly, and cardiovascular disease, all predisposing conditions for COVID-19. Another really important point is that we're seeing the worst cases, the worst fatalities from COVID-19 in large populated areas such as very big cities. So there is a strong link between that and COVID-19. Around 80% of people who develop COVID-19 will just get a minor illness that lasts for a week or two, a bit of a cold, runny nose, sore throat, a cough, maybe a bit short of breath, then they recover. But 20% of people develop a condition we call cytokine storm, where there's an excessive reaction by the immune system to the virus. And that's where we have all of the health issues that I'll discuss very soon with COVID-19. I'd like to talk about the 5 key areas for the solution for COVID-19. Number 1, and very importantly, and this is just our general reaction to any viral illness, to any pandemic, the most important features here are things like social distancing, washing your hands. Now, this is the interesting thing with washing your hands. When you wash your hands, sing in your head, happy birthday. That's the amount of time you need to spend washing your hands. Cleaning common surfaces is also very important, has been shown to markedly reduce the risk for diseases completely. Also, we have to look at the importance of things such as self-isolation, quarantine, the lockdown rules, and also travel restrictions. These things have been very important in restricting the spread of COVID-19. None of us enjoy it, but it's so important. So those general measures are vitally important. Number 2 is your own personal immunity. You need to keep your body healthy, what I call the 5 keys of being healthy. You cannot be healthy and smoke, drink too much alcohol, or use illegal drugs, so no addictions. Number 2 is good quality sleep. 7 to 8 hours of good quality sleep is as good for your body as not smoking. Number 3 is nutrition, and I'll get to that towards the end of this section. Number 4 is having a regular exercise habit, 3 to 5 hours every week of moderate exertion, and the most important drug on the planet is a thing called happiness. When we're talking about nutrition, there are some very specific things you can do to reduce your risk for COVID-19. Most importantly, have 2 or 3 pieces of fruit per day, 3 to 5 servings of vegetables per day, because fruit and vegetables have a huge amount of what we call polyphenols, which are strong protective plant chemicals. Also, there's been some recent work on vitamin D levels. Now, if you can maintain your vitamin D levels within the normal range, people who do so appear to have the lowest rates of COVID-19, serious complications of COVID-19, and death from COVID-19. Number 3 is the antivirals. Now, up to now, there hasn't been a huge amount of research in medicine, apart from areas such as HIV and maybe the treatment of shingles, for antiviral therapy. But this is probably one of the advantages of COVID-19. We've been able to focus on antiviral therapy. So let's look at what doesn't work and what appears to be working. Certainly, President Trump's hydroxychloroquine doesn't appear to work. There was a big study of about 96,000 people showing that, in fact, using hydroxychloroquine with or without azithromycin, another antibiotic, didn't really help COVID-19 and possibly increase the death rate. So let's put that one aside. There's been use of some novel antiviral therapies that have been used for other conditions such as hepatitis C, lopanavir, rotenavir and ribavirin, and this has shown a weak benefit in reducing viral shedding. There's been quite a bit of promise shown for an antiviral known as remdesivir, which has been shown now in a trial of 600 people to significantly improve the clinical situation of people with the more severe versions of COVID-19. A very small but very promising study was from a tyrosine kinase inhibitor known as acalabrutinib. This has been shown in a small study to have significant clinical improvement. Another small but promising area is using convalescent plasma from people who've recovered from COVID-19 and giving that to patients. And again, small studies have shown some improvement in that area. Number 4 is just the general management of the more severe cases of COVID-19. So hospitalising these people early and treating them early. Of course, using oxygen. Of course, the appropriate use of ventilators for people who need them. But there's been, again, some early work showing that anti-clotting agents can help improve the prognosis with severe COVID-19. And a very promising trial of 6,000 people supervised by Oxford University showed the use of dexamethasone early for a 10-day treatment course can also markedly improve the clinical situation with severe COVID-19. But finally, the real game changer will be a vaccination. To this point, there are over 100 different vaccines being trialled around the world. The first release of one of the vaccines, which was developed again at Oxford University, was done in 108 people in Wuhan, aged between 18 to 60, showing significant response to the vaccine after a month in terms of the immune response, both what we call humoral and cellular immunity. So that's very promising. So they're now starting a second phase trial of 500 people, again, over the age of 60 now, to see whether they will respond well to the vaccine. So vaccination will be the big deal. Whatever happens over the next few years, no one can be really certain. But what we do know that the world is certainly working together to make sure we get through the significant health effects of COVID-19. And I believe we'll come out so much better at the other end with so much more knowledge, and the world will be a healthier place. I'm Dr. Ross Walker, and it's been an absolute pleasure talking with you.